Hello, hi, I'm Zanzi, and welcome back to the Health for Mzansi podcast, episode 102. Proudly brought to you by Health for Mzansi. I'm your host, Joe, and I'm so excited to walk this health and wellness journey with you. Remember, nothing is off limits. This episode, we will talk all things weight loss through access to cosmetic or plastic surgery procedures. Now, I know you have heard and seen of terms such as liposuction, tummy tuck, or breast reduction from your favorite celebs or even TV shows. However, we got to have a chat with Dr. Edward Ngwenya, a plastic and reconstructive surgeon, on how science and art meet and everything in between. Dr. Ngwenya, how are you doing?
And thank you for inviting me and having me speak to you.
It's great for us to get the expert in the room to just shed some light on the topic that we're focusing on for this week, which is weight loss by means of cosmetic surgery. So I think before we get into that detail, doctor, can you maybe just give us some more insight about what it is that you do and your field?
So I'm a double specialist.
Okay.
I'm a general surgeon on the one part, which was my first specialty. And that's where, a lot of weight loss is done, bariatric surgery, a lot of other surgeries targeted predominantly at that. Then I went on and also specialized and have another specialty, which is my current vocation, which is plastic and reconstructive surgery, which I think that is the one you are most interested in. Yeah, what is plastic and reconstructive surgery? Just in layman's terms, it's divided into two. There's plastic, and most people would call you plastic surgeon. That's what we know. But there's a reconstructive side to the surgery, or to the word. So it's plastics and reconstructive. What is plastics? It's taken from a Greek word, plastikos, which means to grow or to form. So say a field where trying to take something through a transformation, making or deforming or reforming something without rupturing it or without disadvantaging it. And that is what we're looking at. So it's trying to reshape the body contour into that which is desirable. So we focus on that which is, in inverted commas, normal, and we try to enhance it on a plastic side to make you look aesthetically more desirable. The reconstructive side, you've lost an element or a part in your body, and so we reconstruct it, a nose, and we reform the nose. We cannot create or perfect you, but we can create the illusion of perfection. So plastic surgery, certainly, what do we do? You know, as advertised, as most people know, everything from the top of the head to the bottom of the head.
Yes,
the top of the head, we can then work on your eyes through different techniques, your forehead, your ears, your nose, the nose jobs that we do, the lips, the facelifts, the neck. We go on to body contouring procedures where we work on the breasts, either to increase them or decrease them, or as nature and gravity takes its course with time, they all decrease. And so we can lift them up, or we work on the arms where they are saggy, bring things and tighten things together, both the arms, the thighs, the tummy as well. We work on the front and the back through different forms, such as those that we're probably going to get into, liposuction and cutting techniques. And then we work on the buttocks, the genitals, of course, as well. Big area where we work on that, whether male or female, increasing or decreasing or changing in appearance. You find other people who have these cultural mutilation or different practices where they increase labia, where we reshape things or tighten things, and all the way to the thighs and the feet. So plastic surgery is a molding discipline where basically science meets art. And I would, just succinctly put it in that way.
Doctor, I really like the way you explained it now, where science meets art. I mean, I've never heard it in that way. And I just think that's so interesting. Cosmetic surgery, is that just another name for it?
Cosmetic surgery, certainly. So within plastic surgery, there is a cosmetic element. And there's a reconstructive element. So cosmetic Plastic surgery, usually used interchangeably,
Okay,
potato.
great. I'm with you on the same page now. Specifically, plastic surgery or cosmetic surgery, like you just said now, it's something that we mostly see on TV or watching these movies. Do you think it's a discipline or procedure that there's not much education about? So people think it's just superficial?
I think I would agree with you to some extent. Certainly, I think there now seems to be a lot of information, but information without understanding is dangerous because that's what makes this field misunderstood, and ill understood. So you say there's education? No, because education is a process that someone goes in, takes this information and applies it, and it contextualizes it for it to have a correct meaning. So there is miseducation, a lot of information, but not enough understanding. So I'd say there's certainly miseducation in that. And there are various factors which cause this. And I would say there's not one particular reason. It's multifactorial, from issues related to people in themselves, individuals, our cultural norms, our traditional, religious, etc. practices, where some have never been exposed to that. But also our socio-environmental, or rather socio-economic dynamics play a significant role, because this information that we have, we see it from TV, which the West, which may be Hollywood. And so we then think, and incorrectly so, that plastic surgery or cosmetic surgery is for those that are rich, wealthy, and it's then something that is superficial. And of course, when you cannot afford something, or where you have little knowledge of something, you give it a name. And one of those may be, it's superficial. It's not for me, simply because you don't understand it. And once you do understand it, then you stop giving it labels. So certainly, we think it's something for the rich, something for the wealthy, and the majority, or if you look at South Africa, or socioeconomic status, majority are impecunious, and so may feel it's not for them. But that is not the case. And I can tell you, certainly for my practice, I see a lot of people. I mean, I do see the celebrities, of course. I do see those who are rich. I do see the politicians. And I see, in inverted commas, the ordinary men and women who come in, your teacher, your policeman, just anybody who comes in and says, look, there's this part in me that I'm unhappy about and I need some help with. And let's see how you can help me. I think there's a mind shift, some form of paradigm shift, where people have come to the realization that, look, man, I've got all these material things around me. If I want a couch, I can get it. I go to Ellerins, I go wherever, and I lay by it. If I want a car, I get it, and I buy this car for 500,000. Look, I'm spending and paying for 5 years or 6 years for this piece of metal.
Yeah.
Yet I don't invest in myself. And I carry myself everywhere. So people have kind of shifted, because we've now got funding models wherein one may enter this field and, improve something about themselves at really low costs and be able to pay it in more spread out intervals. So no, is it superficial? I would certainly say no, because the patients I deal with, I can tell you there's a lot of psychology in there. And the way you look is going to affect the way you feel, period.
And doctor, speaking of which, with the way you look is going to affect how you feel. With regard to weight loss specifically, what sort of procedures are directed at that?
No, Joanne, that's a good question. And I think that's, you've hit the nail on the head. And this is where I would like to just succinctly, be clear this. Plastic surgery, plastic surgical procedures or cosmetic surgeries are not weight loss procedures. And many people will come and they would go to a plastic surgeon because they want to lose weight. And that's the wrong approach that you are taking. Fortunately, fine, I'm a general surgeon. I'm able to do some other things that can assist or refer you accordingly to different ways. But plastic surgery is not a weight loss procedure. It's a body contouring procedure. So what is body contouring? It's body shaping. That's what it is. You do the work, you lose here and then, and then we shape, we tone, we mold this plasticos, we mold you into a better presentable, looking at the aesthetic, features to put you there. So, of course, Joanne, the surgeries carry some weight loss element. And what are those that we do? Let's look at a liposuction. Let's look at abdominoplasty. What is it? Let's look at a breast reduction, for example. In those three, if you've got fat and you've got fat all around, I can take in this tube, this metal piece. I don't need to cut you open. I make a small hole and I put this underneath and I suck. And I'm sucking all the fat around and I remove. And once that fat is gone, it's gone. Look, you can go to the gym and it's simply, hormonal. There's a certain distribution of fat in women. There's a certain distribution of fat in males. There's a certain location where you are not going to lose that fat. Try hard. Good luck. You will keep going, but it's going to be so difficult. And you can't run away from it. You can come in and liposuck that area. So certainly when that fat is sucked out, it's sucked out. It's gone. So liposuction is one. And you lose, of course, the weight depending on the amount of a fluid or fat you suck out. And when I do a tummy tuck, maybe on people who have a lot of skin, and you usually have this belly that maybe has two rolls, pregnant does it, food does it, dessert does it, and so you may end up with that. And so that belly, there's no way you're going to suck it all out. We need to cut some skin off as well because there's excess skin. So there we take it all out and we flatten you. We make you flat and it looks good and you will lose some weight. I mean, my average tummy tuck, depending on who I do, will maybe lose just from that fat 2 to 3 kilo, and the liposuction that we do a bit more. Now that's we very, safe and conservative. But the point is not to make you lose weight. There are many patients who've come to me wanting to lose weight through plastic surgical procedures, and I've turned them away. I don't operate everyone who comes here. I don't let the money, suitcase on the table make my decisions. No, it's about your safety. And we'll tell you that, no, this is not the way to go for this. First, these measures, but you need to be the right candidate to undergo plastic surgery because there are dangers associated with it if it's done on the wrong patient.
So, Doctor, I'm glad you've actually highlighted the next point. When a client comes to you and you've explained this to them, like, we cannot make you lose weight, you do some of the work, we assist you. But what are some of the requirements that the patient has to meet before you giving the final okay for a procedure such as liposuction or a tummy tuck or a breast reduction?
There's a lot. Criteria depends, of course, on the procedure that's required. And the person, remember, Joanne comes to me and Joanne says, look, Dr. Ngwenya, I would like to lose this lower abdominal fat and I'd like a liposuction or a tummy tuck. I'm not sure. Do I meet the criteria? Then I've got to look at you and say, look, Joanne, number one, let's start here. I'm not treating your tummy. I'm treating an area that is attached to Joanne. Meaning, I don't treat parts, I treat the human being. And Joanne comes here with the kidney, with lungs, with a heart, with all other organs. So we're treating human beings with areas that they want to be changed. So we've got to look at you holistically and see that you may have other ailments, diabetes, hypertension. It may be controlled or not controlled. So we need to make sure that all those other factors are controlled and you are not at an aesthetic risk. Obesity in itself gives you a risk for all other ailments such as high blood pressure, diabetes, inter. However, there are other things that are more common with weight, such as if we do an operation on some people who are morbidly obese, you may have something like a deep vein thrombosis. You may have something just like your wounds don't heal so well compared to the ordinary Joanne who's fine, and not obese. Therefore, we've got to look at you holistically as a person. And then we'll go into the area. And then I've got to speak to you, Joanne, and say, what are your expectations? Because you've got to come in with reasonable expectations. You can't come to me and say, look, and that's what some patients do. They come with pictures. I'm not going to mention names.
Did someone
Of
bring in a picture
course,
of Beyonce?
all the time. You will be so amazing. And that person weighs, 200 kilograms, and they've got the
Sure.
money. They want to look like Beyonce. And then I've got to be real with you and say, come on, right? Look,
Sure.
this from where you are to where you want to be, realistically, I'm not going to get you there in one simple operation because I'm not a wizard. But let's meet realistic expectations. And then we walk through this process together. So yeah, patients come in with so many pictures. Oh, I want to look like this person. They've never done anything. Some of them I just keep quiet because I've operated some of these celebrities. They they have the pictures. And I just laugh to myself, say, if you knew the work we did. Yeah. But I've just got to say, oh, wow. Okay, because, we've got that confidentiality that we don't discuss
Yes.
anything. Yes, but there are dangers as from other diseases, and you've got to qualify from that. And last but not least, you've got to be psychologically sound and able to take that. I've got people who come, and in other words, you've got to do it for the right reasons. You don't do it to keep a marriage. You don't do it for other people. You don't do it because you think if now suddenly you have this nose, you are going to get this job. And so it's quick to pick up a lot of people who do things because of being pushed or they are following a trend. And so those ones we've got to say, no, 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 no. What are your reasons? And we've got to address those. And if I pick up anything like that, I will then send you to the psychologist or the psychiatrist that I work with for an assessment. They may come, they may leave and find another plastic surgeon who may cut. But look, we've got to stay safe and we've got to make sure the right Joanne comes out of this process and is so happy after this procedure.
Definitely. Doctor, thank you. That was quite a mouthful, but also just so educational. It's good to know that it's really an holistic approach. It's not just, I've got the money, I've got the picture, please do it. And what can you do? It's good that, you really take everything into consideration. And now that we know, the dangers, and I think the advantages are quite clear. When you come out at the other side of this procedure and you are satisfied, you love what you see. But are there any other sort of advantages to being fortunate enough to having access to these type of procedures?
One that I forgot to mention as you are speaking, the biggest danger is the wrong provider. If you want to get this done, go to the right person. And there are many people around who are not certified, who are not, qualified, who are endeavoring and taking on a lot of these procedures, a lot of liposuctions, and they do it cheap. And people who go to Turkey, eventually you will spend much more money because you will go to a plastic surgeon who's now going to have to fix what was, made by what was messed up. Some people come out right. It's luck of the draw, but it's your life, it's your body, and you don't want to spin a coin, to see which results you're going to get. So I just needed to mention that. You've got to make sure you're dealing with the right guys. Your advantages, I would say, number one, a simple thing. Here's a breast reduction. People coming in with back pain, shoulder straps, not finding the right sizes of clothes, etc. Now, besides the psychological impact therein, there's also the physical strain on the back, the rashes that go underneath, the bigger tummy, then under that, it's a moist area. People would put powder in that area. So there's issues of hygiene, etc. So those are certainly the advantages, getting rid of all of those. There are people who have hyperhidrosis, who sweat so much. And if you come simple Botox procedures there, you will never sweat for the next couple of months. So we deal with a lot of that. But I would certainly say functionally, there's those advantages. I must say psychologically, that's the biggest advantage. And why do I say that? And it comes to where my area of speciality, I've been a surgeon, qualified and working as a general surgeon. And I'll tell you this, I would remove a lot of cancers. Breast cancer, woman comes in with breast cancer, people, and we remove cancer and we saved your life. That's what we look at, a surgeon, to save life. I've removed your breast. You have one breast, but hey, be happy, Joanne, you're alive. You could have been dead. Patients came out happy that they're alive, but I've seen people being depressed because I came to learn that being alive is not enough. The quality of life thereafter matters. So being alive is far different from living. And when you have to live, and the quality of life comes a lot from the appearance. So there's no woman wants to go out just because they had breast cancer and they have one breast. They're happy that they are alive. No. They would like to have two breasts and live a fulfilled life. You don't want your breast to be sagging there anymore after you breastfed or for any other reason. So after a breast lift, so amazing. After a breast augmentation, after a tummy tuck, wearing the clothes and that dress in summer and that bikini you always wanted to wear. And the men, there's many men, by the way, don't think it's a woman thing, being able to come out in shorts from those skinny legs after those calf implants, etc. So there's certainly a huge psychological impact therein. And that's where I think the crux of it should be, not the social media. I think the whole point, if you're going to do cosmetic surgery, in my view, I don't like going over and you looking out like this deformed or unnatural being. It must make you look like you. And people should not know you underwent anything, but just appreciate and say, wow, why are you looking so good? You can just tell them, look, I drink water with cucumber and lemons, and I'm dancing and all of that stuff.
Yeah, I would think they can share your details.
They can go, okay, well, that's too.
Yes, doctor. Doctor, just in your personal experience and knowledge, do you think that, especially in the last 10 years, I would say, has there been more of a welcoming to these type of procedures? I think sometimes there is a thought that South Africa is a bit conservative. Has this opened up for some people?
Definitely. A big yes. It's changed so much. And it's changed the generation that's coming. The generation that's, come through, the younger generation, they have greater exposure. We have greater exposure to the world. We are global citizens rather than isolated within your closed knit environment. So you see the world, and whatever I can tell you, the world, you see it yourself. I can no longer block the world away from you. So the world is there. Two, also, people now are more open. Liberation plays a role. Education plays a role. Emancipation economically, so in itself also plays a role. So the rise in middle class also opens it up. So I can tell you there is a big increase. I mean, I've been in some radio and TV shows, and indeed, the people who would call in, they will tell you, oh, I will do it. And people are no longer scared to say, look, I went and I had it. And so what? In some places, it seems fashionable to state that you did. But certainly, and I can tell you worldwide, having been to other countries around the world, or my practice, even just today, the patients out see people are more open. You get people from Zambia flying in, Malawi, or wherever, and populations or racial groups that have opened up, and predominantly in the African Black population, but those cultural norms seem to somewhat have settled down, and people are more able to come out and take on this. So I would concur with that assertion to say, certainly, I've seen it.
Thank you for joining this week's episode of the Health for Mzansi podcast. For more on our weight loss and cosmetic surgery chat, check out healthformzansi.co.za. Now remember, if you are in a medical jam or just curious about some health and wellness trends, you can send an email to hello@healthformzansi.co.za or send a message to 076 132 0454. Here, we're on Blue Tick. So there you have it, gals and guys. The space where science and art meet is not as easy or superficial as we might have thought. The body is complex and needs an holistic approach when trying to remedy or fix something. whatever you decide, make sure you are informed by verified health practitioners and services. Until next time, keep well, stay healthy. Signing out, your girl Jo.